Some countries put in place export restrictions, and there were several instances of requisitioning key medical supplies for national use. Supply nationalism exacerbated the pandemic and contributed to the total failure of the global supply chain. For a period of time, some countries were without key supplies, such as key items for health workers who were dealing with surging cases of COVID-19. And many countries still do not have enough. While there is a wish amongst leaders to protect their own people first, the response to this pandemic has to be collective. This is not charity. We have learned the hard way that the fastest way to end this pandemic and to reopen economies is to start by protecting the highest risk populations everywhere, rather than the entire populations of just some countries. Sharing finite supply strategically and globally is actually in each country's national interest. No one is safe until everyone is safe. No one country has access to research and development, manufacturing, and all the supply chain for all essential medicines and materials. And if we can work together, we can ensure that all essential workers are protected and proven treatments like dexamethasone are available to those who need them. With PPE and tests, a collaboration between the public and private sectors meant supply was increased in order to support fair and equitable use of scarce products. As new diagnostics, medicines, and vaccines come through the pipeline, it's critical that countries don't repeat the same mistakes. We need to prevent vaccine nationalism. For example, once a successful vaccine has been identified, WHO's Strategic Advisory Group will provide recommendations for their appropriate and fair use. The allocation of vaccines is proposed to be rolled out in 2 phases. In phase 1, doses will be allocated proportionally to all participating countries simultaneously to reduce overall risk. In phase 2, consideration will be given to countries in relation to threat and vulnerability. Frontline workers in health and social care settings are prioritized as they are essential to treat and protect the population and come in close contact with high mortality risk groups. Initial data has shown that adults over 65 years old and those with certain comorbidities are at the highest risk of dying from COVID-19. For most countries, a phase 1 allocation that builds up to 20% of the population would cover most of the at-risk groups. If we don't protect these highest risk people from the virus everywhere, and at the same time, we can't stabilize health systems and rebuild the global economy. This is what the first crucial phase of the vaccine allocation mechanism aims to do. We are all so interconnected. As a small example, vaccine developed in one country may need to be filled in vials with stoppers that are produced in another, using materials for the high-grade glass that's only available from yet another country. We will need to quickly manufacture billions of doses to reach all those who need the vaccine, which means hundreds of millions of glass vials and ways to transport them effectively.